Today we've got a significant health update that's already sparking strong reactions across the medical and public health community. The CDC's Vaccine Advisory Panel was expected to vote on a major change to how and when newborns receive the hepatitis B vaccine. But instead of making a decision, they've chosen to indefinitely postpone that vote, leaving the issue unsettled and raising more questions than answers. Right now, the standard medical practice in the United States is for babies to receive their first dose of the hepatitis B vaccine just hours after birth. This birth dose has been the cornerstone of preventing hepatitis B infections in children, particularly because the virus can be passed from mother to child during delivery. But here's the proposed change that was under consideration. Instead of giving every newborn the shot at birth, the vaccine would be delayed until 1 month of age, but only if the mother tested positive for hepatitis B during pregnancy. On paper, this might sound like a targeted approach. However, many doctors and public health experts argue that this is risky. Why? Because relying on maternal testing isn't foolproof. Tests can sometimes be missed, improperly recorded, or not communicated in time. And in some cases, mothers may not have received proper prenatal care at all, meaning their hepatitis B status is unknown. If the birth dose were delayed, any of these gaps could allow a baby to contract hepatitis B without the protection of the vaccine, and that infection can have lifelong consequences. One doctor on the panel summed it up clearly. We actually have the ability to prevent children from developing a serious infection that can later lead to liver cancer, simply by giving every child that birth dose. To them, pulling back from this universal approach isn't just a change in policy. It's potentially putting children in harm's way. It's also worth remembering that hepatitis B is not a minor illness. It's a viral infection that attacks the liver, and in chronic cases, it dramatically increases the risk of cirrhosis and liver cancer. For newborns, the danger is even more serious. Roughly 90% of babies infected at birth go on to develop chronic hepatitis B. This is exactly why the universal birth dose has been such a central tool in preventing disease for decades. So with the vote postponed, where does this leave parents and doctors? For now, nothing changes. The current guidelines still recommend the hepatitis B vaccine shortly after birth. But the fact that the vote was even on the table and now delayed without a clear timeline has left many wondering if the CDC's vaccine advisors are rethinking long-standing practices in a way that could create more confusion than clarity. And this wasn't the only topic on the committee's agenda. The same panel also made a significant move regarding the COVID-19 vaccine. In a unanimous decision, they decided to step back from broad, one-size-fits-all recommendations. Instead, they now say that getting the COVID-19 vaccine should be a matter of individual decision-making. In other words, it's no longer being positioned as a universal public health directive, but rather as a personal choice, something for each person to weigh with their healthcare provider. That's a sharp shift from the tone of past years, when the CDC strongly urged vaccination for nearly all Americans. Now the approach is more flexible, acknowledging that different people face different risks and may want to make their decision based on personal health factors, age, or other circumstances. Taken together, these two developments, the postponed vote on the hepatitis B vaccine and the shift in messaging on the COVID-19 vaccine, highlight just how much vaccine policy is evolving right now. The debates are not just about science, but also about trust, communication, and how to balance public health goals with individual choice. So what's your take? Do you think delaying the hepatitis B birth dose is a dangerous gamble, or is it a reasonable adjustment to current policy? And how do you feel about the CDC moving toward personal choice when it comes to COVID-19 vaccines? Drop a comment below.